In December 2004, a massive earthquake formed a tsunami off the coast of Indonesia. With the speed of a jet plane, it smashed into the island of Sumatra, killing nearly 200,000 people. 2 weeks later, I was part of a South Australian medical team that responded into Banda Aceh to continue the emergency surgical and medical care that was started by the New South Wales team. Due to significant delays, it took us 3 days to get into the country. So after unloading our nearly 10 tonnes of equipment, we collapsed exhausted into a damaged but functional hospital. We decided to rest overnight, come up with a plan in the morning, but that was not to be the case. That night, we were woken by Indonesian soldiers who brought in 2 of their colleagues with gunshot wounds. One had clearly unsurvivable injuries and the other needed urgent surgery. Under the watchful eye of the armed soldiers, we quickly got to work trying to save his life. This set the scene for the next 2 weeks, during which time we performed nearly 130 procedures in operating theatres, looked after dozens of patients with sepsis, saw an ever-increasing number of tetanus patients, plus the everyday medical and trauma patients that started to return to the hospital. So what was it that allowed us to cope with such an unexpected and overwhelming situation? What I'd like to discuss with you is some strategies and tips for preparing for this scale of emergency. Now bear in mind that there's not a lot of science in this and there's a lot of personal opinion, but we'll see where that takes us. First of all, responders must be aware of the big picture. There are international agreements and there are definitely local laws that must be obeyed. Even if you volunteer independently, you need to comply with what's in place locally, and you must ensure that your efforts are aimed at helping the community and not hindering them. For quite some time, aeromedical and retrieval services have understood the advantages of a cross-trained workforce. Our retrieval doctors, nurses and paramedics cross-train to be able to interchangeably perform critical tasks. There are a lot of advantages in this in a disaster situation, quite clearly, and so we should look at expanding our scope of practice. One of the things that we can do is look to our colleagues from other professions. Rather than be siloed, we should try and understand how they do their jobs and learn from them. Equally, we can pick some specific training that may be advantageous: disaster medical training, obstetrics training, learning a second language. All of these are exceptionally useful. However, just because you expand your skill and knowledge, it doesn't give you carte blanche to go off-piste in a disaster and go outside of your accepted scope of practice. In Aceh, I admired how our surgeons passed on skills and knowledge to their local colleagues. They understood the benefits of leaving a legacy. Any knowledge and skills that are passed on to local providers will be far more powerful and enduring than any treatment that you may provide while you're there. Equally, we should make efforts to record and publish our activities so that others may benefit from our experience. But what about situations you couldn't possibly imagine? I noticed some of the video before, and I'm sure that most of us would be aware of the rescue of 12 school kids and their coach from a flooded cave in Thailand by Dr. Richard Harris, one of my friends and colleagues, and a vast number of other people from all over the world. Harry's a senior anaesthetist and he has significant experience in retrieval medicine, but I bet none of his formal training involved dark caves or muddy water. So it was a combination of medicine and his other passions that contributed to the successful rescue of those kids and their coach. His group have completed some of the longest and deepest cave dives ever recorded, and often in some of the most remote parts of the world, requiring them to be self-reliant for long periods of time with little, if any, outside support. Their dives are sometimes so extreme that equipment such as camera lights implode from the pressures that they experience. And so their group have had to create or develop or produce their own equipment because there are no commercial products available. In Aceh, a combination of creativity and MacGyver-like skills were put to good use. Patients with fractured femurs, fractured limbs had external fixators formed out of water pipes and dental putty. We found uses for empty water bottles, such as spacers for Ventolin inhalers or incentive spirometers, and even handyman tools were modified to be able to perform medical procedures. You don't need to be an underwater anaesthetist to be able to do these skills, but time spent exploring being creative, and looking outside the box will never go to waste. What about high acuity, low frequency cases that, depending on where you work, you may only experience once in a career? I was on a retrieval shift one night and my colleague and I were sent to a victim with stab wounds. On the way there, we discussed a number of options, including the possibility that we may have to perform a thoracotomy. When we arrived, the patient had just arrested and the paramedics were commencing CPR. We examined the patient and found that they had a stab wound just under the ribs. We simply nodded to each other, quickly explained what was about to happen, and proceeded to open his chest, remove the pericardial clots, close the hole in the right ventricle that we found, and commence internal cardiac massage, with barely a word spoken between us. The procedure was performed as if we'd done it as a daily occurrence, although neither of us had done one in anger. We'd both performed it in training, but most importantly, we had both mentally rehearsed the procedure over and over. The power of mental rehearsal, along with a shared mental mindset, should not be underestimated. The concept of expedition mentality is that the success of the mission is more important than the needs of the individuals. Team members must be willing to go beyond their personal comfort zones in order to support mission requirements and team harmony. Try and develop a can-do mentality in your daily life. Equally, the team must be willing to support individuals in time of need, as the loss of a team member may affect the entire team. Missions such as international deployments must be treated as a marathon and not a sprint. In Aceh, we rapidly became fatigued from the severe heat and humidity, the long working hours, and some of the additional physical challenges that many of our team members weren't used to. Tempers can fray due to physical and emotional stress. Tolerance, humility, and a sense of humour are highly desirable qualities for anyone in an expedition. We should also be self-sufficient. Food and other commodities may be in short supply, and we shouldn't burden the communities that we're there to help. And finally, we need to look after our psychological health whilst we're away and when we get home. When I returned from Aceh, I found that I became angry at trivial things compared to what I had just witnessed. And now, after 15 years, I can still smell the mass graves that we used to drive past. Support services are widely available, and we need to be willing to make use of those as we see fit. So in summary, we can't possibly prepare for every eventuality, but we can work on developing the skills and attributes that will support meaningful activity in a crisis. We need to look for opportunities to expand our skill sets and pass those skills and our gained knowledge on to others. Make sure that we are as physically and mentally prepared as we can possibly be. Adopt an expedition mentality in which we become problem solvers and not burdens, and be prepared for the psychological challenges that we may face. If we enthusiastically develop these skills and attributes, we will ensure that we are as prepared as possible for the unknown. Thank you.
Morning, Dave. Craig Wiley for SmackForce News. I've got a couple of questions from our audience. The first one would be, how do you use your skills as a paramedic, and what cross-training have you done to ensure that you are an asset to a team responding to a disaster area?
I think there's space for people from all different clinical groups to work in a disaster environment. I think the paramedics potentially find that a little more comfortable than some of the others because every day we're exposed to unknown and different situations. I think some of the skills that I've gained have been from my experience as a paramedic, but equally I think, and just as importantly, the skills that I've learned off my other colleagues, my medical and my nursing colleagues, I've been able to put to good use. And I think that's why it's important that we look right across all the professions and break down those silos.
Thank you. Now, Dave, self-sustainability in a disaster zone is an important aspect. You need to take your own food, your own water, and essentially look after yourself. Have you ever come across groups that do not have these honourable intentions?
Yeah, absolutely. In Banda Aceh, unfortunately, we had many people who were willing volunteers who'd come from all over the world. and turned up with nothing but a day pack on their back and a bottle of water, expecting to be supported while they were saving the world. And they actually became a significant burden to us in terms of what we were able to provide, because we had to support them as well. But also to the patients, because we were actually trying to employ cooks and buy food so that we could feed our patients so that they were healthy enough to go and have repeated operations in theatre. And we couldn't do that if we were having to cleave off part of that food source to other responders.
Thank you, Dave. And then lastly, one thing, if you had to go back and go back to a disaster zone, what is the one thing that you would do differently?
I think having been there, I would have a better understanding of the challenges, both physical and psychological, and be more acutely aware of the need to pace yourself and look after your own welfare as well as those that you're there to help.
Thank you. Craig Wiley signing off for Smack Force News, Australia.